Justine Ross was appointed Chief Executive Officer of the Australian Asbestos Safety and Eradication Agency in August last year. Prior to this, she was Acting Group Manager of the Work Health and Safety Policy Group in the Department of Jobs and Small Business, responsible for policy development and advice on Commonwealth work health and safety and workers' compensation, maritime workers' compensation and work health and safety matters, asbestos matters and workplace relations issues concerning the building industry, including on the re-establishment of the Australian Building and Construction Commission and Building Code. Please welcome Justine Ross to talk on the National Strategic Plan for Asbestos Awareness and in Management 2019 to 2023, including improving the quality of asbestos-related training. And I won't bore you with my Lang Hancock quote, but...
Okay. Thank you. Okay, thanks very much. And I have to excuse, I've got a bit of a croaky throat and I might sneeze as well, and I also might start coughing. So I'll just say that now. But I'm really actually quite very pleased to be here to speak to this conference about asbestos safety, because plumbers are amongst the trades that are at really high risk of exposure to harmful asbestos fibres when working in old commercial buildings and also domestic buildings. And this is just not the case in Australia. It is, of course, many places throughout the world. But at one stage, Australia was the highest per capita user of asbestos in the world. And I guess that's why we sort of have a unique framework in place now to manage our legacy. Okay. The green button. Great. So I just want to sort of begin by giving you a snapshot of the problem. It's estimated that around 4,000 Australians die each year from asbestos-related diseases. This figure, it comes from a paper that is yet to be published by Professor Trim Driscoll of the University of Sydney, but it's based on the World Health Organization Global Burden of Disease study. And this, often when I say this, it often actually surprises many people that it's actually more than double the number of annual Australian road deaths. Okay, not very good with the slides. The third wave is what we use here to describe the current sufferers, or those who are at risk of contracting asbestos-related disease. And that's those that are undertaking their do-it-yourself home renovation. The first wave was those that were exposed during mining and production in Australia, and the second wave was tradespeople who were working with asbestos products. So the Australian Institute of Health and Welfare estimates that each year between 700 and 800 people in Australia are diagnosed with mesothelioma. In 2018, that was 699 people. Australia does have one of the highest rates of mesothelioma in the world as well, but rates are also high in the UK, in the Netherlands, and in Italy and Malta. In more developing countries, it's really not known what their rates are, and that's sort of because it's a really hard disease to diagnose, so they just don't have the technology and the medical expertise to do so. And that is part of the reason why it's sort of difficult to get a worldwide ban as well in place, because many countries will just say, oh, we don't have the problems, we don't have the same rates of death. Well, that one worked. So the World Health Organization says that there's no evidence of a safe threshold that exists, or a minimum exposure level to prevent adverse health effects from the use of asbestos. So this is because the chemical is capable of producing cancer by directly altering the genetic material of the cells that it targets. I don't have a medical background, but I work with medical experts in the area. So therefore, that's why asbestos is regulated under the assumption that it poses a risk to humans even at very low doses. And you may have heard that some will say, you know, one fibre can kill. Then you'll hear other experts saying, well, low exposures are fine. So there is debate in the community about that. But the thing to remember is that it is regulated under that assumption that even very low doses pose a risk to human health. And that's what the World Health Organization has said, and the International Labour Organization as well. There were over 3,000 products containing asbestos in Australia before the final ban was put in place, which was in 2003. So, I think many of you would know commonly where you would find it. So, of course, in fire blankets, insulation around heaters and stoves, tiles, there's cement roofing, fencing, pipes, tubes. Asbestos rope was used a lot. There's floor coverings, brake pads, which were one of the final products to be phased out here in Australia, and electrical switchboard panels, and that's just to name a few. We also have a problem in Australia with illegal dumping of asbestos waste. So we commissioned some research in 2016 to attempt to estimate the amount of illegally dumped asbestos-containing materials, and our study showed that it was 6,300 tonnes dumped each year, and that's costing around at that time it was costing around 11.2 million to clean up, and a lot of this cost falls to our local councils as well to clean up the mess when dumped in mainly around bushland. And of course, we still have the problem of naturally occurring asbestos, and workers encounter that, and that's quite common actually, probably more common than you think, in the case of roadworks. So just to explain to you the aim of my agency, so it's to assist the prevention of exposure to asbestos fibres in order to eliminate asbestos-related diseases in Australia by coordinating what we have in place as a national strategic plan. So we are not, in fact, a regulator. Because Australia is a federation. We've been established as a national body to work with the other states and territories and a range of non-government bodies as well. So we work with industry groups, we work with unions to just coordinate the efforts around Australia. We're the only country in the world to have such a body that is actually devoted to asbestos safety and management, and that is mainly because of the large amounts that we still have in our built environment. And I might go through these dates. The next slide is just showing you some dates that have been sort of significant in managing asbestos in Australia. As I said before, the most significant date is 2003, when we put the last ban in place, and that was to ban all uses of chrysotile asbestos. The other dates up there are just around when national codes were put in place as well, and when Safe Work Australia developed the last lot of work health and safety regulations. But the law is fairly consistent in managing asbestos throughout the country. The next lot of dates is just in 2012, there was a big review undertaken, and that's the Asbestos Management Review, and that was when that review that recommended the establishment of the agency and the establishment of the National Strategic Plan. So the National Strategic Plan, it just ensures, as I said before, that there is just a coordinated and nationally consistent approach to awareness, management and removal. And one of the major reasons for this is just to reduce, I guess, unnecessary duplication, and therefore sort of to reduce the costs that can be borne by governments and not only governments but by the non-government sector as well. So we've just, at the end of last year, developed what we're calling the next phase of the plan. So the next phase of the plan goes from 2019 to 2023, and it contains 4 national priorities. Now, I guess these priorities, sort of like, I think you could apply this elsewhere, as I say, elsewhere, particularly in the UK, in New Zealand. The same sort of national priorities, because the same actions need to be taken. The first one is to improve asbestos awareness to influence behavioural change. So what we find is we run an awareness survey. So every 2 years we've run a survey. Our cohorts are tradespeople. We also run it amongst DIY home renovators, and just workers who may come in contact with asbestos as part of carrying out their work. We find that awareness levels are very, very low amongst homeowners. They're a bit higher amongst tradespeople, but then we actually find that they don't often, then that translates into actual safe behaviour. So there's a gap between knowing that it's dangerous and then, in fact, working safely with it. So we are going to do more work in this space over the next 5 years, and one thing that we really want to achieve is producing nationally consistent awareness messages. Because if you put asbestos into Google, you'll come up with a range of things on asbestos by a range of groups, some of them being government, some of them being non-government. There'll be information there, some of it contradicting the other forms of information that are there. So we sort of want to, it's all fragmented. So we want to, in fact, get this consistent messaging out and consistent advice about what you need to be doing. And we want to really produce some practical information as well, particularly in the home for homeowners. The next one is identification and effective legacy management. So when the chrysotile ban was put into place in 2003, it didn't require the removal of asbestos from the workplace or from the home environment, from the built environment. The law says that if it was in a good condition, it could stay in place until it deteriorated and needed to be removed. So that's the system we have in place, and that's the policy at the moment, is to identify, is to give the asbestos a risk rating, and then to manage it safely. So we also want to start developing a better picture of where asbestos may still be in our environment as well. The rate that's located in homes, the number of homes that may contain it. One number that's often used is 2 and 3 homes. 2 out of 3 homes in Australia contain asbestos. In some places it will say 1 in 3. I think, the ACT may say 3 and 5. But we're undertaking some work to do some better mapping. Because again, since the ban has been put in place, even the situation has changed very much. In some old suburbs, houses have already been torn down. New houses have gone up that are asbestos-free. So we want to sort of work out where we really do need to target, because if anything really built after really the 1990s is unlikely to contain asbestos. The next priority is safe, prioritised removal and effective waste management. So safe, prioritised removal means having, so if you do your register, if you have a commercial building, you may do a register on it, and it's just prioritising that the asbestos that is at high risk, that removing that first before getting to the others. It's common sense, really. But that's also for governments as well, for governments to have a plan about where they should be starting to remove or where they should be looking at. Again, you hear a lot in the media about the schools, because often kids find asbestos in the playgrounds and things like that. So schools have been a big area for governments to focus on. The effective waste management just means improving the accessibility and availability of waste disposal facilities, and that is in an effort to reduce illegal dumping. We also have the case in Australia that levy fees differ around the country as well. So in some jurisdictions, it might be expensive to dispose of your asbestos. In other jurisdictions, for a homeowner in the ACT, it's free to do so. And the final one is international collaboration and leadership. So the Australian government takes a very strong position internationally that asbestos mining and manufacture and use needs to be banned worldwide. So we do some work particularly in Southeast Asia to help our neighbours, put in place actually the necessary framework in order to ban asbestos. Our new strategic plan, it contains targets. The old one didn't have any targets, so it was very difficult to measure progress. One of the most interesting things about putting in these new targets has meant that we've needed to work out some metrics in order to measure progress. And in doing so, we're finding that there's quite significant data gaps. And in one area, as I said before, just in working out how much is actually still in the built environment. And another thing to just sort of mentioned before, and just because of being a federation, the system in Australia is incredibly complex. So it cuts across a range of areas within governments at all levels. So one of the things that we did is that we've mapped all the roles and responsibility of what we're calling the key stakeholders in the asbestos management system. We all think that they have a role to play, particularly in raising awareness, and we want to sort of convey that it's a shared responsibility and that we all need to work together. Now, we actually do quite a bit of work on focusing on trades. We have a committee that has both industry representation and union representation that helps us put together some information that we then distribute. So this is from some brochures that we've put together for the plumbing industry. And of course, it's important for plumbers to know where asbestos is before they begin work, particularly in old buildings, because so many of our homes and commercial buildings contain asbestos. And we recommend that, and actually the laws require, that if it's unclear whether the material is actually asbestos, it needs to be assumed that it is present, and the steps need to be taken. So the law needs to be taken, the steps in the laws needs to be taken until you go and get it tested and it's proven otherwise that it's not asbestos. This is some from the brochure as well, and this is some common areas that you might come across it in commercial buildings. I think it would be all pretty obvious, but pipe lagging, asbestos ropes, and water and drain pipes. And of course, this wouldn't be unique to Australia. It would be the same case in other places around the world, and particularly in New Zealand. We do a lot actually with New Zealand and the New Zealand Work Health and Safety Regulator, and they've adopted Australia's safety laws. And they basically have the same problems. The next one is residential areas as well. So asbestos rope is commonly found in residential properties. Asbestos cement sewer vents and food pipes also, and in drain trap surrounds and water meter covers. And it can also be asbestos in toilet cisterns. They can also be made of asbestos or cement that contains asbestos. So this is, I guess, a few questions. These questions that are up on the slide is really what needs to be considered before work commences. So is the asbestos-containing material non-friable? So asbestos is categorised as either friable or non-friable. Both present a significant risk to workers, but friable means that you can crumb it between your fingers. It can easily become airborne, and then the fibres then can be released and you can inhale them. Now, friable asbestos can only be removed by what we call a Class A asbestos removalist. In all states and territories, apart from the ACT, it is still legal to remove less than 10 square metres of asbestos-containing material. It's interesting that 10 square metre, that amount, and we've been doing a bit of work into why it was set at 10 square metres. It's said that, well, that was sort of like the size of a kitchen, a bathroom, a laundry. So if they were being renovated, the tradies could actually remove some asbestos without calling in a licensed asbestos removers. In the ACT, no matter what the amount is, you have to call in a removalist. So if the answer to all those questions is yes, then that you do not need a removal licence and no notification to a regulator is required. But if any one of those, the answer is actually no, then a removal licence is required. You have to have the relevant check to have the, and the benefit of getting a removalist licence in as well is that they will be adequately insured, because it is actually the case that asbestos in insurance policies is excluded. So, and that's another area of work that we're undertaking, because it is actually excluded from a majority of regular insurance policies. So if you make a mess with it, you may be exposing yourself without any insurance to cover. So that's just more from the brochure that we've produced. Here, it's really, really popular. We get many requests for this brochure. We have it in hard copies. We're sending boxes of it out all the time. And I think what's really appreciated is just some simple do's and don'ts. So, of course, not to use power tools, not to use compressed air, particularly do not use high pressure water hose. There was a case in Queensland a few years ago where someone got up on their roof and started high pressuring the roof. The asbestos went absolutely everywhere, and not only was then they had to do a decontamination of that property, but all of the neighbours' properties as well, and in fact going to the extent of removing all the vegetation and the soil from the surrounding properties. And then the materials, of course, need to be tested, and here in Australia the laws require that they're tested by an ANADA-accredited laboratory. But if you are then able to work on it's less than 10 centimetres, it's non-friable, and it needs to be worked on, then you need to ensure that it's thoroughly wet down and that it's kept wet down during the work. And I'll just finish a little bit on training, because this training thing popped up very strangely in the little title of this presentation. So just the training requirements, and this is in a workplace, so these are under work health and safety laws. Of course, there is a requirement to train workers, just a general requirement to train workers about the risks associated with their work. There's also requirements that relate just to asbestos, and that is that they need to be trained in the safe handling and identification and control measures as well. In the ACT, the training requirements are a lot stricter, and that's come about because of the Mr. Fluffy houses, as we call them in the ACT. They're houses that were found to have loose fill asbestos in them, and over 1,000 of them were eventually demolished. So since July 2019 in the ACT, there is a requirement to train workers in an additional course of working safely with asbestos, and that's required to be completed by workers in occupations identified at higher risk of exposure, and that is all the trades, the plumbers, electricians, and as well as telecommunication workers. So we are actually doing some work at looking at options for improving the quality of both the training that's delivered and the content of that quality, and that's particularly for workers carrying out asbestos-related work, so who come across it in the course of doing their job, and including who may remove less than 10 square metres of fireable. So that's it. They're the contact details, and yes, please go to our website and look at what we produce, and if anybody needs anything in hard copy, just let us know.